Hi, everyone. We are back with another session where we get to bring questions that you have directly to physicians from Carbon Health to have those health science related questions answered. And today we'll be talking about a highly requested topic, which is all about measles and the MMR vaccine. And to do that, we are joined by Dr. Sujal Mandavia, who is the Chief Medical Officer at Carbon Health. And measles is a viral infection that typically leads to a very common red rash on someone's body. But I'm going to turn it over to Dr. Mandavia to just talk a little bit more about what is measles and how does it spread from individuals?
It's a primary respiratory illness that's caused by a virus. It is distinguished because it is so highly contagious. It's primarily spread through airborne, so particles just from breathing, but also obviously if you cough or sneeze, that can accelerate that. And it also is hardy enough to live on surfaces and be picked up by people. So if somebody coughed on a surface or sneezed on a surface and you came by and you touched that in a few hours and then touched yourself, you are at risk of actually getting measles from that type of exposure.
That's really important. I think knowing that it can both be that respiratory type as well as surface type makes it so incredibly important, as you mentioned, that we're talking about this today. And so if someone does happen to come in contact with that in either vector form, what would be the serious health consequences of someone if they actually contracted the virus and it led to a sustained infection?
Yeah, let me talk about the acute illness first, because I think it's important that everybody at least understand how it progresses and how you can recognize it. You mentioned the rash, which is definitely a hallmark of the illness, but it actually doesn't even start with the rash because it has an incubation period of even up to 10 to 14 days. So it means that you could be exposed and be generating virus and starting to get sick, but not quite ill or manifesting illness for quite a while. Once you've developed the rash, you've actually already been contagious for a few days before that. And once you have developed the rash, you're also contagious for a few days after. So you can kind of see why it's a bit of a sneaky culprit. You can be, just like we discovered with COVID, you can actually be contagious before you realize you're sick. And it's also very highly contagious, meaning its attack rate or the ability for it to cause infection based on exposure is very high. After you are exposed and you have this incubation period, most people are going to develop a fever. And then following the fever, you'll get cough, runny nose, you might get red, watery eyes. And then after that is typically when the rash appears. And once the rash appears, it makes it much easier for us as clinicians to kind of spot the diagnosis sometimes from the doorway, or at least on examining a patient. But you could see that it's not always as easy if you're just showing up with a fever and some cough or runny nose. Those are certainly symptoms that cross over with the common cold as well. You did ask about the more serious complications. Honestly, the reason why everybody should be interested in measles is because it does have quite severe complications. They were common enough before the advent of vaccine that they were a significant source of, honestly, mortality, as well as even chronic illness for patients. And so we're very fortunate that we have tools like our vaccines, like the MMR vaccine. But to think about some of the potential complications, there's pneumonia, which can be very severe, especially in young children, and also in those who are over 20 years of age. So you can see that there's a large part of the demographic that is at risk of things like pneumonia. There is something called encephalitis, which is a fancy word for inflammation of the brain. And I don't think you have to be a physician to know that having inflammation in your brain is probably not a good thing to have, and it's not. That can be extremely serious. And if you actually don't die from that, you could still have other long-term sequelae like damage to your brain, losing function, hearing damage, or seizures. So it's certainly the type of complication we want to avoid completely, which we have the ability to do, again, with effective vaccines. There are other ones that are a little less serious, but probably more common, whether it's vomiting and diarrhea. It can cause things like croup in a very young age. And then there is one that's not as common, but it's very severe and it's also very delayed. It's something called subacute sclerosing panencephalitis. Long word, but what it does is it causes damage to the neurons in your brain at a much later stage. We're talking about 10 to 15 years after the measles infection. So just like we've learned, like there can be long-term sequelae or long COVID. With COVID, there's kind of a long form of measles that if you get immunized and you don't get the acute infection, now your risk of having that has gone to zero. So I know I'm keep repeating about vaccines. It's because like we're fortunate we actually have a tool that is effective here.
So having all these different types of symptoms, especially in the acute phase, it can be kind of similar to other types of respiratory viruses. So is there any specific tests that can be run for someone if they're coming in experiencing some of these symptoms? Maybe they've been known to be in an area with a local outbreak. Can they get tested for measles at a clinic?
I'm glad you asked that, Rob. So, we have the capability of being able to collect and send out tests to test specifically for measles. We do that in two kind of broad buckets. One is we can try and get a direct sample. Similar, and I know I'm bringing up COVID because I think everybody's familiar with COVID now. We can do a swab to try to detect the measles virus itself, and that is one set of tests, which is a molecular test, again, similar to how we do molecular testing for other pathogens like COVID. It's highly accurate. So that's one set of tests. You may or may not be able to use that depending on kind of where the patient is in the phase. So we also tend to send blood tests, which are called serology, and those look for antibodies, which are your body's immune system fighting soldiers and serve as a marker for whether that type of infection has been activated. So we can look for two distinct types of antibodies. One that's called IgM that shows us, hey, there's been a very recent exposure and we've got like the early army that's been deployed to try to neutralize the measles virus. And then there's a longer term antibody, which is IgG. And those ones may or may not actually show you that you had an infection recently, but also serve to show us whether you have immunity to that virus too.
No, that's perfect. And great to know that there's, the ability for people to come in if they are worried, like just go and figure out, and maybe even if it's not measles, rule it out as one of your potential viruses that you could be suffering from.
Yeah, I think it's important to really reignite our sense of awareness of this virus. It's unfortunately a virus we're now seeing again. I think it might have been in the 80s when we actually declared that measles was eradicated. And unfortunately, that was brief when you think about the history of time, but it's back. And primarily back in areas where we see less than full immunization because it's so incredibly contagious. It is truly a public health emergency. It is really good to, if you think that you're at risk, let's get you tested and let's learn about that with certainty so we can not only take care of you, but honestly, we're taking care of the people who are around you that could be potentially exposed.
Absolutely. Totally agree with that. And I'm really glad you brought that up, like looking at not just yourself, but so many people in your community that could be at risk. And we also had a really interesting question come in from the audience, which something that I wasn't aware of, but they were asking about the specific side effect of having measles, which is known as immune amnesia. Would you be able to touch a little bit on that and what does that even mean?
Yeah, so that's great. I actually credit to your audience. You have a very sophisticated audience to ask that question in the first place. So kudos to your audience. Immune amnesia, specifically with measles, has to do with the fact that measles and some other viruses have the ability to actually directly impact or attack our immune cells. And by doing that, what they can effectively do is kind of take out the immune cells that might have actually been generating the immune response to not only fight measles, but also fight other infections. So this virus is extremely sneaky because it will go in and it's basically taking down your defenses and not only leaving you exposed to a more severe measles infection, but you may have another virus come along at the same time or another infection. and it's leaving you more exposed to those effects because you just don't have the same level of immune response available.
Yeah, definitely not good stuff, especially related to some of the longer term things like 10 years out, plus now looking at some of the more chronic type of things that can arise from a measles infection. Very important to be aware of your current status related to protection, as well as know if you have it via a test. And then this kind of leads really nicely into another question that somebody had was, if they do have a positive test for measles, are there any treatment options that are available, or do they kind of just have to wait it out?
It's another really good question. And there isn't necessarily a specific medication or treatment for measles itself on the therapeutic side. There is some possibility that if you are detected within the right window, or if you have been exposed but not yet sick, we may be able to give you the measles vaccine as a post-exposure prophylaxis. And so that is an option. There are some therapeutics that we'll use in patients who are hospitalized, who have specific types of complications. So I don't want people to think that there's no hope if you get infected. It's not as simple as, oh, I've got a bacterial infection, let me take an antibiotic, or, oh, I have COVID, so I should just go get Paxlovid. We don't have that for measles, which is why the vaccine is so important, especially because we know it's so effective.
Exactly. And let's move right to that subject. So we've talked about treatment. Let's go into prevention. And you mentioned that it is effective. So how effective is the MMR vaccine? And maybe for some people who might be tuning in, what exactly is MMR as a vaccine as well?
So the MMR vaccine is a combination vaccine. So rather than just having the vaccine for measles itself, we include mumps and rubella. And you might ask, well, why are we combining them? And there's a few reasons. One is that nobody likes to get stuck for a vaccine. So if I could get a 3-for-1, like, let's do it. And honestly, that is a big part of it, that we want to try to minimize the burden that's on our healthcare delivery system, as well as our patients, so that we can minimize the number of encounters or needle sticks and give the maximum amount of protection. The other thing too is that these other viruses are also, just like measles, very important. Their wanted posters would be up in the post office, just like measles. You know, mumps and rubella have some very serious complications, and again, are very preventable. So let's knock it out. These are very safe to give together, which is the other reason why we know we can combine them. There is also some benefit of actually having more than one exposure or antigen in a vaccine that gives you an even more robust immune response at the time of vaccination, which basically just kind of charges your immune system in a even more effective way. So it might give you longer term protection. All that being said, your original question was, well, how effective is it? It's extremely effective. We give it as a 2-dose regimen. It gives about 93% coverage with 1 dose, but honestly, you get 97% with 2 doses. And that is the standard recommendation. It's what I would certainly advocate for as well. These are often given as part of the childhood vaccination series. So if you're on a standard schedule, you're typically gonna see a child get that at, like, the first one at about 12 to 15 months, and then a second dose at about 4 to 6 years. And you might ask, well, why do we give it when they're so young? It's because the risk is also extremely high for these viral infections in the very young. I kind of mentioned before, if you're under the age of 6, or if you're over the age of 20, then you're actually at higher risk for complications.
What would be the reason why the MMR vaccine might be really effective compared to, say, some other types of vaccines like the flu, where we know we have to kind of get an annual shot? Is this more so related to the vaccine tech, or is it like the virus itself?
Yeah, I think that it's a little bit of both, to be honest. And I'd probably say that we're fortunate, even though measles is a nasty virus, it's relatively stable. So it doesn't tend to mutate frequently enough that it would escape the effectiveness of a version of a vaccine. So this kind of 2-dose regimen will give you long-term protection because of that, because the same antibody response that you would get doesn't need to evolve or change. So that's one thing, and that's silver lining to measles. That's it, is that at least it's not mutating rapidly, that would be extremely scary. The other thing is from the vaccine preparation itself, the measles vaccine is what we call a live attenuated vaccine. And what I mean by that is that it's actually a form of the virus itself that has been mutated in a way where it's weakened, and it can't actually cause infection. It can provide an exposure to you and your immune system that gives a very robust response. So rather than taking a little fragment of the virus and exposing you to that, there's a lot of the other virus we're kind of leaving without exposure that could actually matter in your immune response. But we're fortunate here that we're able to use like a live attenuated vaccine that gives us a more robust response. If you contrast that with like the flu vaccine, it's a killed virus. It doesn't have that same type of real life exposure that gives the same kind of response. Or as I said, if you're talking about a vaccine that's just providing more of a fragment of the pathogen, that may also miss some of the response that we're hoping for.
Yeah, no, that's perfect. And I know you had talked about like the 2 doses. So we had some individuals asking, what about a booster? And actually it kind of triggered my mind too, because I'm recently will be traveling and I just got a booster for Tdap. So it was like, oh, it's been 10 years, why don't you get this booster? And it got me thinking, oh, I wonder if like a booster for MMR could be necessary. And is it necessary, and in what type of populations?
It's not, I'll just say it's not broadly necessary, which is good. We tend to get effective immunity. Now, I will kind of give you a proviso on that. What we don't necessarily anticipate is prevalence of the virus in the way you may see in these outbreaks. And certainly if the outbreaks become more like what we've become more homogenized, meaning the prevalence overall in the community goes way up, we may need to consider a revaccination campaign. But if your probability of getting exposed is low, we're not necessarily recommending that everybody get routine boosters. There are some specific populations like healthcare workers where we will measure titers of vaccine response to see if somebody has adequate exposure, because we know that they are at higher risk of getting exposed. So I think bottom line is most people don't need to worry. It is effective. It has proven effective. Like what we have are actual decades of results that show us, hey, actually people didn't get boosters and we're okay. We haven't seen these outbreaks. The outbreaks actually have been more concentrated in the under-vaccinated or non-vaccinated communities. So that's a further proof point that that's actually where we see the spread, not that it kind of catches fire and spreads across folks who've been previously vaccinated.
Yeah, and I'm really glad you brought up like the recent outbreaks, because there was some folks on our channel who were concerned about these local outbreaks that have been occurring over like the past year. And they were just interested to know, do you have any more information about these outbreaks? I know you mentioned they're typically occurring in more unvaccinated populations, but how much risk does that put at the general population as a whole?
It's one of those things, I don't think we want to test that theory too much, right? Like we know without a doubt that if you are not vaccinated and you're exposed, your risk is about 90% of getting measles. And we already have kind of talked about all the bad things that could happen once you were infected with measles. What we also know is that, again, it appears that if you have been previously vaccinated, it kind of builds a ring around these outbreaks. So that's very encouraging. But what's sad to hear or see when I read about these outbreaks is just how preventable they are in the first place. And I know that everybody has their own thoughts about vaccination for or against. Totally respect that. But I would tell you, as somebody who is a physician, that there is proof that these are effective, and there's a risk that we're carrying when not vaccinated. We carry enough risk stepping outside of our door every day, crossing the street, right? I don't think anybody needs to carry that extra burden of being exposed to something, especially when we talked about it is easy enough for a person who has measles and infected with measles to not even know and expose people around them in very normal behaviors, socially acceptable way, but yet expose somebody and actually infect them. So I don't want to induce panic, that's not what this is about, but I want people to be informed. And again, this is a risk you just, I don't think, need to take.
Perfect. And wrapping it up with our last question, it's really related to this. What advice do you have from a physician's standpoint if somebody or their family member is exposed to measles, maybe even in one of these localized outbreaks? What could they do?
Yeah, I think if you're exposed and you haven't developed symptoms yet, I think reaching out to your healthcare provider, and obviously if you're close to a Carbon Health, we're here and available for you. Reaching out to your healthcare provider, making sure that you're monitoring for any symptoms, and trying to, before you understand whether you have the infection, try to make sure that we're good stewards and making sure we're not putting other people at risk. So isolate, making sure you're covering your nose and mouth, and washing your hands frequently, because again, it can live on your hands and on surfaces. But I would say, bottom line is make it easier for yourself, reach out to your healthcare providers who should be able to help navigate you through this. And whether they do the testing or whether they direct you towards public health, I think they will help figure that out with you and for you, making sure that you're staying responsible and really engaging with your healthcare providers.
So this was a fantastic discussion all about measles and the protection that the MMR vaccine can give us. So I really want to thank Sujal so much for coming out and chatting with us and answering everyone's questions. So on behalf of myself, as well as my audience, thank you so much, Sujal, and to all of Carbon Health.
Thanks, Rob. So happy to be able to participate in this. And thank you for what you're doing. I think it's really valuable service. Obviously what you have done during these last, 2-3 years during the pandemic has been absolutely invaluable, right? In providing that kind of translation. But as you can see, there's more to science and health than just COVID. So I'm looking forward to lots more topics in the future.
Yeah, thank you so much. And yeah, on that note, if you have other suggestions for future topics for discussion, please feel free to leave a comment and let us know what you want to hear from next. So with that, we will see you on our next Physician Q&A. Thank you. Bye.